Hello, it's Dr. Christine Arseneau, PharmD, Functional Medicine Certified Health Coach. Wanted to talk about fat today. Fats have kind of gotten a bad rap, and fats are really good for us as long as we know which fats are good for us and how to eat the healthy fats versus the unhealthy fats. And so the fat-free or the low-fat trend is something that is kind of over now, I would say, but it's been circulating for a while. It's been thought that fats contribute to heart disease, but in reality, when we look at animal products and fat versus sugar, it's, oh my gosh, my dog. Grandma, what do you want? She wants to say hi, I guess. Come here. What do you want? What do you want? So really, there has been an increase in sugar, and that is probably what is associated with the higher increase in heart disease instead of fat. And so fat has kind of been villainized, but fat is a really important for us as far as absorbing nutrients, the fat-soluble nutrients. So vitamin A and D and E and K, those are the fat-soluble vitamins, and we need enough fat in order to absorb those. And we need fat for hormone production and for our cell membranes. So eating healthy fats is really important, and good quality is really what you want to look for. So when you're looking for fats and oils, you want to go for cold pressed over things that have been processed with heat, as that will keep the fats in a healthy state like we want it. So you also want to look at your smoke point on fats. So you don't want to use a fat to cook with that has a low smoke point, because it'll go rancid, which then won't be healthy. And so if we are looking at the different types of fat, trans fat is actually the kind that is worst for our body because it's hardest for our body to break down. And that's what you would find in shortenings and margarine and things like pastries and cookies and things like that. Whereas saturated fat, although it's gotten a bad name, the saturated fat is actually more stable. And things like coconut oil and butter, they're high in saturated fat, but they're more stable as far as cooking with and as far as just being better absorbed by our body. So it's the hydrogenated vegetable oils that we really want to avoid. So anything that has the word hydrogenated or partially hydrogenated, that's going to have the trans fats that we do not want. So again, we want to go for quality, we want to go for cold press, we want to go for a high smoke point if you're cooking with it. Otherwise, you don't want to heat up the fat. And again, the fats are really important for your cell membranes, and that's something that a lot of people with Lyme have issues with. We have damage to our cells because of the ongoing infections that we've had. And even something like mold exposure, eating healthy fats is important because you kind of want to dilute out the mold, the mycotoxins, with plenty of fluids, plenty of good quality fat. And the solution to pollution is dilution. So you want those good clean fats to just kind of clean out your system. So good quality fats are a good idea for somebody that's struggling with Lyme disease, any issues with your cell membranes, just to keep you satiated and full and satisfied. I know in the past, years and years ago, when I tried to do lower fat diets, I was just starving all the time. So having a good quality fat can just really make you feel satisfied, especially if you have a lot of health challenges, a lot of food allergies, things that you can't eat, and you might be feeling a little bit frustrated. Adding some good quality fat is a good way to just feel more satisfied and have more options for things to eat. Let me just see if there's anything I missed. So saturated fats are stable. They don't oxidize and cause inflammation. So again, you want to avoid the trans fats and the vegetable oils and anything hydrogenated, but the saturated fat is actually more stable. It's also the only food known to increase your HDL levels, which is the good cholesterol. And there's a lot of information on cholesterol particles, and that the size of the particles is more of the issue, not eating fat or eating cholesterol. That's not what contributes to heart disease. It's probably the higher sugar that does, and the hydrogenated oils as well. And again, saturated fat, foods that naturally have saturated fats are just really nutrient dense. Most nutrient dense foods, and the nutrients are in a bioavailable form, so you can actually absorb them. Yeah, so I think that's about all that I wanted to say about fats today. If you have any questions, feel free to comment below. And if you have any fatty snacks that you love, maybe like fat bombs, if you're doing a keto kind of recipe, I would love to hear what your favorite fat-filled snacks are. I hope you have a wonderful day.